Terence Higgins Trust recognizes that employees who work together may form personal friendships and in some cases close personal relationships. Whilst it does not wish to interfere with these personal relationships, it is necessary for the charity to ensure that all employees behave in an appropriate and professional manner at work. The aim of this policy therefore is to provide clear and concise guidelines on personal relationships at work, including situations where family members work alongside one another, whether they are with colleagues, peers, managers, service users or volunteers, and applies to all employees regardless of their job or level of seniority. The dictionary definition of a personal relationship is: an interpersonal relationship is a social relationship or connection between two or more people. There are numerous forms of personal relationships that an individual may establish throughout their lifetime, including kinship, family relations, friendship, casual relationships, relationships extending beyond one-night stands that exclusively consist of sexual behavior, and intimate relationships, where there may also be an emotional attachment between the individuals involved. For the purpose of this policy, the charity is primarily concerned with the possible impact that sexual and emotionally dependent relationships could have on employees and the aforementioned groups whilst at work. Whilst the charity has no wish to infringe on the personal lives of its employees or on how they conduct their personal relationships, it does have the right to know when there may be an impact on an individual's work, or may present a conflict of interest or perceived conflict of interest. Conflicts of interest may arise when employees are providing a direct service to service users, as they may feel obliged to offer a service beyond the realms that THT can provide, or feel pressured to compromise themselves in some way. The employee may also find themselves accused of corrupting or taking advantage of an individual, particularly if the partner has been met through a youth group. Such conflicts can lead to service user complaints or safeguarding investigations. Where the relationship is between two employees, conflicts of interest may exist, or be perceived to exist regarding line management, support and supervision, and other areas where treatment may be unfair based on relationships. Such conflicts can lead to reduced staff morale and perceived or real unfair treatment, and can lead to disciplinary action, grievance procedures, or bullying and harassment investigations. Though the charity believes that its employees are adult enough to manage the ups and downs of a personal relationship tactfully and discreetly, there may be occasions where the breakdown of a relationship could lead to complaints or allegations that will impinge on the individual's work life. By creating these guidelines, we wish to establish clear procedures to be able to avoid these incidents and to resolve any disputes that may affect individuals' working relationships quickly and with the minimum amount of disturbance to the involved parties as possible. It is not the charity's place to mediate between individuals on their private matters, unless their behaviors impact on their own and/or the department's work. Once the relationship becomes established, or at the same time as the individuals involved are willing for their colleagues' peers to know about it, whichever is sooner. By declaring it as soon as possible, the individuals will hopefully avoid rumor and speculation regarding their personal life. Any employee who embarks on a close personal relationship with a colleague working in the same department, local center, or team must declare their relationship to his/her manager. Relationships between members of different departments, local centers, or teams should be managed discreetly, and should only be reported to line managers when there is a perceived conflict of interest. Both parties will be expected to act within the rights and responsibilities of the charity whilst at work or whilst on charity business at a place that is not a THT site. If the relationship is between a manager-supervisor and an employee whom he/she supervises, the relationship should be declared to a senior manager and to the Human Resources Department. The information declared will be recorded on the personal files of both employees and treated in strict confidence. Where the relationship has been formed with a more senior member of staff but there is no line management aspect, both parties should inform their line manager of the situation along with Human Resources. As before, the information declared will be recorded on the personal files of both employees and treated in strict confidence. In order to avoid a situation in which an employee has managerial authority over another, with whom he/she is having a close personal relationship, the charity reserves the right to elect to transfer one or both of the employees involved in the relationship to a job in another department section. In these circumstances, the charity will consult both of the employees and seek to reach a satisfactory agreement regarding the transfer of one or both of them. In such a situation, if it is not possible to transfer at least one of the employees, for example, if no suitable vacancies exist, or if an employee refuses to transfer, the charity will endeavor to explore alternative arrangements to retain both parties in employment with THT. The charity reserves the right to dismiss one or both employees with notice in accordance with the employee's contract, or pay in lieu of notice. Dismissal would, however, be undertaken only as a last resort in circumstances where no other course of action was reasonably open to the charity. In principle, relationships should be avoided. However, the charity recognizes that sustainable relationships can arise through people meeting in the workplace service center. Whilst this may not present an issue where the employee does not provide a direct service to the service user, relationships which have formed as a result of the service being provided must be declared to the employee's line manager as soon as it becomes apparent that a relationship beyond that of a service user-service provider is being formed. In these cases, the employee should no longer provide a direct service to the service user and the service user referred to another employee for the same service, if practicable, or to an external agency, if this is not possible. Relationships between employees delivering youth services and service users of young people's services will not be permitted. Further guidelines on boundaries between youth work employees and users of young people's services can be obtained from the HR department, and must be upheld by all employees working directly with young people. Staff who are direct caregivers, have direct care responsibilities, or who work within clinical services, or perform any clinical role as part of their substantive role, are not permitted to form sexual relationships with any client, former client, or carer. These relationships will often be seen as inappropriate, however long ago the client-staff professional relationship ended. Further information can be found in the following document: Clear Sexual Boundaries Between Healthcare Professionals and Patients. Responsibilities of healthcare professionals. Under no circumstances should any member of staff provide a direct service, including any clinical service, screening, or testing, to anyone they have ever had a sexual or social relationship with or are related to, including by marriage. If any staff member is unclear whether or not this applies to them, they should speak to their line manager or the on-call team before the service is given. If a staff member believes they may have inadvertently breached this policy, e.g. not recognizing the person until afterwards, they should report this to the line manager as soon as possible, and the incident should be logged in line with THT's incident policy. Likewise, any relationship with service users who are deemed to be vulnerable adults are strictly forbidden. Employees and volunteers should also not act in a manner that could reasonably lead to the assumption that they are breaching this policy, for example by inviting service users to their home for late-night social events, or similar behavior, and should seek guidance from their manager if in any doubt. This could also include the sharing of contact details and any other social event, with the only exception being an arranged social event by THT for service users, for example a Christmas party. The borrowing or lending of money between service user and employee or volunteer is prohibited under any circumstances. Where a relationship develops between people in these groups, both individuals should inform their line manager as soon as practicable. Where possible, the employee should not be in a position to supervise line manage the volunteer, to avoid possible conflicts of interest. If this is not possible, then the volunteer should be allocated other duties, or if possible moved to another department. Where there is a pre-existing relationship between the employee and another member of staff, existing service user or volunteer, this should be declared to the employee's line manager as soon as practicable. This should also be the case should an employee's partner become a service user during the course of the employee's employment. Where there has been a previous relationship which has ended problematically, and the employee feels that this may affect their working life, they should inform their line manager immediately, so that they are aware of any issues that may arise. It is not advisable for an employee to encourage a family member to apply for a role in the same location. Where recruitment has already taken place, including sessional work or a volunteer role, a staff member who is related to a shortlisted candidate should not preside over a recruitment selection process. Where family members currently work in the same team, management should take every reasonable effort to ensure that a family member is not in a management or supervisory position, or in some other role allocates work, resources or benefits including training and development opportunities to another family member. The trust will take such steps including redeploying one family member to another team, or changing normal line management relationships should professional boundaries become blurred or cause operational difficulties in teams. Where the steps required are not reasonable in relation to the negative impact on service efficiency or effectiveness, or not possible due to the lack of redeployment, the charity reserves the right to dismiss one or both employees with notice in accordance with the employee's contract, or pay in lieu of notice. Dismissal would, however, be undertaken only as a last resort in circumstances where no other course of action was reasonably open to the charity. It is understood that there is no solid definition of the family. In this context, therefore, it is expected that staff should declare any type of close or family relationship. In certain circumstances, this can include those living in shared accommodation. As in all circumstances, staff will then be expected to follow the rights and responsibilities and values of the charity, in order to avoid suspicion and allegation. Any employee who is involved in a close personal relationship with a colleague or volunteer must not allow that relationship to influence his/her conduct whilst at work. Intimate behavior during work time, for example kissing, touching or holding hands, is expressly prohibited. This rule applies during all working time, whether at the normal workplace, on client's premises or elsewhere. Any breach of this rule will be regarded as a serious disciplinary offense leading to disciplinary action, up to and including dismissal. Employees are expected to be mindful of existing THT policies, such as the confidentiality policy, and what can and can't be discussed outside of the workplace, and of guidelines around annual leave and toil. It should not be expected that if one employee has been granted annual leave for a particular period, that the other will automatically be granted it at the same time. Whilst the charity will not unduly monitor the levels of sickness or absence of any employees reportedly in workplace relationships, should a repetitive pattern emerge, then action will be taken in the usual manner under the charity's sickness absence procedure. Please note, volunteers are classed as employees, though they are not paid, and have the same rights and obligations as salaried staff.